Hello my loves. So for those of you that have been here before, welcome back. For those of you who are new, hello, I'm Lauren-Jane. I'm a junior doctor and I just started core surgical training. So as always, today we are talking about medicine, no surprises. But today I am talking to Faye Bate and Basha Mukherjee, and I'm talking to them, I'm asking them, I hope, the really hard-hitting questions, because I think as medics we have this weird burden of not being necessarily taken seriously if we're female med students, or having to reconcile our personal lives and how we present ourselves personally with our professional lives as doctors. So for those of you that don't know, and I'm sure you do, Faye Bate is a fourth year medical student, but she also has a significant YouTube and Instagram following. So I'm really interested to know how do the two affect her image and how she presents herself. And similarly, Basha Mukherjee is Miss England. So at the time of filming, she was the Miss England. She handed her crown over only a couple of weeks ago. And she's also an NHS doctor. So two amazing, incredible women. And I'm asking them, hopefully, some really hard-hitting questions, which hopefully will help me and you think about how we think about our image and whether we're taken seriously and all of that stuff. So let's get into it. If you don't already, please like and subscribe. Now let's get into it. Hello, welcome back. So the first question that I want to ask Faye is, do people have a hard time believing that you're a med student? And I ask this because people do have a hard time believing that I'm a doctor, and sometimes I have to argue the point. Like, yes, I am a doctor. I'm wearing a lanyard, it says doctor. And it can be a bit exhausting to have to keep on saying this. So is this just me? This is what I want to know.
Question number one, has anyone ever had a hard time believing you're a medical student? I mean, I don't think that they'd say it to me, but you can definitely see it in their eyes, especially when I find it really funny when someone asks what I do and I say, oh, I'm at medical school, and then they say, oh, so you're going to be a nurse. And I just think, you definitely wouldn't have said that, number one, if I was a boy. Number two, I've literally just said I'm doing medicine. If I was going to be a nurse, I would say I'm doing nursing. So I definitely think you can see the shock in people's face when you say you're doing medicine, or they come out with something like that, but I don't think anyone would have the balls to say it to my face.
Similarly, Basha, I want to know, do people have a hard time believing you're a doctor when you say you're Miss England? Do they have a hard time believing that Miss England is a doctor, or that a doctor could be Miss England?
The honest answer is I'm not really sure, because I'm not people. Usually they do come out with a, oh really, but that's it really. I don't really pay attention too much to people's reaction. Mostly they already know that I'm a doctor, because mostly they've sort of come across me either at the workplace, or obviously if I've been invited to an event, usually people will know because of my name being advertised as Dr. Basha Mukherjee. But yes, the honest answer is I'm not really sure. Maybe they do.
Say, I want to know, do you think there are preconceived notions about people who study medicine?
Absolutely, and I think that they are so detrimental to the profession. For example, one of my friends, her mum is really one of my best friends. Her mum really doesn't trust healthcare professionals. She's had a lot of bad experiences in the past with doctors, with family members, their grandma, their GP missed a diagnosis of cancer in their grandma, and then their grandma passed away, unfortunately. And there's been a lot of other things, and she just does not trust doctors, full stop. And I think a large part of that comes down to her seeing doctors as, just to be completely honest, doctors as just old white posh men. And she is, like, I come from a very, I want to say, like, a very normal upbringing. Like, I went to a state school, and I think part of the reason she has this mistrust with doctors is when she looks across, when she meets a lot of doctors, they don't represent the background that she comes from. And I think if you're a woman, if you're a different sexuality, if you're not a straight person, if you're not a white person, if you're not a posh person, then I think that it can create this gap between medical professionals and the general public. And I think a large part of that comes from the stereotypical medical student or doctor.
And Basha, what I want to know is, similarly to Faye, do you feel like there are preconceived notions as to how people should behave and present themselves as a doctor?
Absolutely 100% yes. I think people expect doctors to be professionally dressed, but also at the same time there's an expectation for you to be a plain Jane, look as unnoticeable as possible. And this happens in the workplace as well, where you will see nurses, HCAs, they'd wear makeup, they'd have really long lashes. But as a doctor, I feel really awkward having eyeliner on or mascara on at one of the days. I think there's a general sort of expectation that you be more subdued in the workplace and otherwise. Yeah, I think it's almost seen as, you know, your professional capabilities are looked down upon almost if you're, I don't know, dressing up a bit glamorous.
Do you feel like these preconceived notions are common in medical school? And if so, are they problematic in any way at all?
Absolutely, I think it's common. There's a lot of people who are not being true to themselves, and definitely problematic. I don't think we realise how exhausting it can be pretending to be somebody that you're not. And medicine is a hard enough career as it is. It's exhausting without feeling like you can't be yourself. And, you know, we've got huge burnout rates, people who get very, very, very stressed, and I think feeling more at home in your career, feeling more at home in yourself can only be a positive thing. And at this moment, I don't necessarily think we're fostering that environment.
Basha, what I would like to know now is it easy to be a doctor and Miss England? These feel like very, very different job roles.
I'd say in the beginning it was really fun, because I was working in a DGH, a District General Hospital, a smaller hospital, and there was just a lot of positivity I faced from my colleagues all around. And maybe that was because it was a small town and that was just how they were as people, because I think that says a lot. I've been in different cities, worked in different hospitals, in different sized hospitals, and I've noticed a certain energy about smaller towns and how they approach a situation. So in the beginning, I think it was an icebreaker. It really helped me make friends, and I could really take people on the journey with me, which was really important to me because it was something completely new and alien even for me. I did have an extended reign because of COVID-19, and I found towards the second half of my reign things were a little bit difficult, and I really had to conceal the fact that I was Miss England, even though, surprisingly, people knew, unfortunately, and I did find myself being very anxious when I found out people knew, because the thing is that unless they already had a relationship with me of some sort, a professional relationship, where they'd got to know me as a person, if someone knows something about you without you telling them that, they already have an idea in their head of what kind of person you'll be, and that will impact the way they come across to you. And I did face that a lot of discrimination. So I wanted to almost set aside that Miss England factor about me and focus solely on being a medic and establishing myself as a team member. And I found that to be therapeutic for me personally, in developing my own confidence in my own skills and abilities. And also, you know, building a relationship with my colleagues, because different places are different, people are different, and they'll approach a situation differently. Do I think that they're at odds with each other? Sometimes I feel like having the title for 2 years sort of weighed on me a little bit, because it seemed to be the only thing that was defining me beside me being a doctor, when in reality I wanted it to be a part of me, not just all of me. And now I'm sort of come to the end of my reign. I've just got less than a month left now, a couple of weeks actually. Yes, 2 weeks from today that I hand over my crown. I'm actually looking forward to the next chapter of my life, to be able to move forward and be saying that yes, I did win Miss England. I had an amazing journey, but it's onwards and upwards from here. And actually who I am and what defines me is a doctor. I want to be taken seriously as that. So yes, I don't know if that answers the question.
Do you feel pressured to look or act a certain way? So I put this one in there because I definitely feel the pressure of this. So it's definitely something that I've struggled with on Instagram, is how I present myself, and whether that fits in with the fact that people, you know, I might be someone's CT or whatever, and they're my F1, or they can be my patient. And this is something that I've struggled with. So that's why I want to ask the question. So please tell me what you think.
Not so much anymore, and I actually think that YouTube has been a huge help with that, because I found that the more that I was true to myself and honest with myself, actually the more it resonated with people, and I actually found a group of people who I felt supported me in being myself, and you know, maybe could see themselves in me and seen parts of my personality that they had been repressing because of medicine. So definitely in first year I felt so pressured to act a certain way. I felt a bit like a fish out of water. There weren't many people in medical school that I could completely relate to, and 100% that changed the way I behaved, but now not so much. And I think it's so important to be unapologetically yourself, as long as it's respectful of other people, because at the end of the day, the truer you feel like you're being to yourself, the longer you're going to be able to enjoy your career, and probably the more successful your career is going to be in the long run.
We've now entered selfie mode. The next question is, do you feel taken seriously as a medical student? And I wanted to put this one in there because I sometimes don't, and this I think has been perpetuated by sometimes when as a medical student, male consultants will kind of only make eye contact with the male medical students. And I've been in F1 before, and the male consultant would talk exclusively to the male medical student and just completely treat me like I'm not there. And in some ways that has like almost led to me like not feeling completely taken seriously, especially as I've said things like, you know, wanted to do surgery. People have been more like, oh, well, you know, if you're surgically minded, think about obs and gynae. And you know, obs and gynae is great, it's fantastic, it's fascinating and exciting, but you know, I want to do surgery. I want to be taken seriously as a prospective surgeon and as a med student, and I'm as serious as everyone else, but I haven't. So I'm very interested to see what you think about this.
Oh, that's an interesting one. I actually think this is why I sometimes I'm and ah about posting my exam results on like social media and stuff, because I think that it can come across as braggy and taken the wrong way. But the thing that always makes me post my exam results is because I know people don't take me seriously. I know people maybe watch my videos and see me having a lot of fun and see me enjoying my life and not presenting myself in the same way as a lot of other medical students. I'm not reserved, I'm not quiet, I'm not that well spoken, and they definitely think I'm thick. They definitely think I'm somehow like, I don't know, scraping along the bottom of my year group. So that's why I do try and share my exam results, because I'm not just passing, like I'm doing well in medicine. I really enjoy medicine, I'm studying hard, I'm just making it a priority to also make time for myself and enjoy myself above anything else. But yeah, no, I definitely think that people don't take me seriously, and that's why I do always make a point of sharing my exam results, because I'm proud of them, and maybe it does show people that there is something up here despite the way I behave sometimes.
So what we want to know next, Faye, is whether you can be 100% true to yourself and a medical student, or whether there's a degree of contradiction between the two.
I definitely think there is a time and a place for toning down your personality. In hospital, I'm not the same as how I am on YouTube completely, and not like I'm being fake, just that I do tone it down a little bit, just because my role in the hospital is to learn, is to fit in, is to just take the most out of the experience. And I think by taking a step back and toning down my personality, then I can get more out of the experience than if I was being all loud and how I am on YouTube. Because at the end of the day as well, what gets views on YouTube, successful YouTubers are successful because they put their personality out there in full. You wouldn't watch someone on YouTube who just kind of was very dull and very boring, but when I'm in a medical environment, it is beneficial to be a little bit more dull and a little bit more boring a lot of the time. So I think that, there are situations where you're not going to be completely true to yourself, but I think it's important to be as true to yourself as it is appropriate at that time. And there's times when I think that I can build a really good rep with patients because maybe they have like a similar background to me, and I can just have a chat to them. And there's other people that I probably wouldn't have as good a rep with, and that's why diversity in teams is so important, because there will be patients that you connect with more, and there'll be patients that other people connect with more, and having that diversity can just help everyone.
We're in selfie mode now for last question. So Basha, last question. What advice do you have for new doctors and medical students?
It's really tough for me to give advice because my journey's been so different to other people's. I will say though that one thing I had too much of during my short career as a doctor so far is advice, and I just wanted to take all of it. And I took all the advice I got too seriously. I'm gonna say, don't listen to people. Take it on board, take advice on board, and be careful not to get that person's attention again so they're in a position to give you advice. But apart from that, listen to yourself, know yourself, go within yourself to understand what you want. You're only going to be really unhappy when you don't know what you truly want from your journey. And yes, the thing I've noticed the most in my lifetime so far is that people have spent more time fear-mongering and warning me about things that they really didn't need to warn me about. They're a different person, I'm a different person. So, as I said, I'm a different person, you're a different person, all of you. So, really, follow your own journey, follow your own path. Thank you. Bye.
Okay, well, I'm so grateful to both Faye and Basha for answering those questions. If you've got any comments, please leave them beneath and I will try and answer them. Thank you so much for watching. Please like and subscribe. Thank you so much. Bye.